Today in this podcast, I want to talk about scarring hair losses and scarring alopecias. This is such an important topic and a devastating topic that it is worth discussing it. There's been a rise of something called frontal fibrosing alopecia, a type of hair loss that occurs in the frontal part of the scalp that is what we call in our industry a trichologic emergency, which means it's something that you can't sit on and let it continue to happen, because what happens is that scarring that occurs underneath the skin in the bulge region of the scalp, which is of the hair follicle, causes an irreversible loss of the hair, and progression of this disease means that you can't salvage it. So a scarring hair loss is caused by unknown reasons. We don't know what causes it. And what I mean by scarring, I don't mean like a keloid or something on your surface of your skin that looks bumpy. A scarring hair loss is a type of dermatologic or skin disease which we don't know what causes it per se, but there's a hair loss that is manifested, and also the skin changes. The skin looks white, shiny. There is sometimes what are called telangiectasias, which means broken blood vessels. There's various types of scarring hair losses. In African Americans, there's something called CCCA, which is called central centrifugal cicatricial alopecia. Cicatricial is a medical term for scarring. So you'll hear cicatricial alopecia, scarring alopecia. The reason why this disease is so important is, number one, as I mentioned, is that it's an emergency to be treated if you just leave it alone. And you need a dermatologist to do that. I don't manage that per se, but I identify it. Another reason is that you cannot transplant into it. Now, I'm not saying you cannot transplant. I've actually transplanted into different types of scarring alopecias or scarring hair losses with moderate success or sometimes great success. But the problem, the reason why you do not want to transplant into a scarring alopecia is two reasons. One is if it's active disease, you will lose all grafts. And also the disease will continue to manifest, get worse, and also the act of the transplant could worsen the disease process. So for all these reasons, transplants are not the first line. The other reason is that success in general is low, and even if you wait for the time for the scarring hair loss not to be active in nature, in other words, that it's sort of quiet, you've been treating it by a dermatologist for a few years, there's no progression of the disease process, and if you do a transplant, that transplant still may fail. So I oftentimes will do some test grafts to see how the survival rate is. And the last part of the thing is, even if you successfully transplant the area, I always counsel my patients that if I do a transplant in a quiet, non-progressive, scarring hair loss condition, that the disease may reactivate years later, months later, whatever it may be, and then you may lose your grafts. So these are all the considerations of scarring hair loss. The problem is, oftentimes right now, what you see is this industry where people that are completely inexperienced doing hair transplants don't understand scarring hair losses, and they're just transplanting everything that moves. And being incoming vice president and then president of the American Board of Hair Restoration Surgery, when I was certified approximately, my God, how many years ago? I just got recertified last year, so that was 10 years in. So 10 years before that, I got my certification. I, as a surgeon, wasn't understanding skin diseases as well as I should. And I think every hair surgeon must know skin diseases. I was in the London airport, and like 20 feet away, I saw this lady. I could tell she had frontal fibrosing alopecia. When you begin to look at it, even at a low threshold of concern, I always advocate to send it to a dermatologist for a biopsy to confirm it. And in cases that are highly suspicious, I will not proceed. And in moderate cases, I will only proceed with a biopsy confirmed by a qualified dermatologist and a dermatopathologist. Dermatopathologist is someone reading that result under the microscope. A crazy story is I had a lady, Mina, who works with me, does initial consultation, and she said, there's a lady that has frontal fibrosing alopecia, looks like to me. And I said, yeah, I saw her come in from like 15 feet away. I saw that she had FFA. And she said, yeah, which is crazy. An area Dallas dermatologist missed it completely and did a biopsy, but did the biopsy of the crown, which is exactly not where it occurs, way in the back, and found it was just male pattern baldness. So this is just absolutely crazy, because dermatologists are the ones that really should be able to read this. But, having done hair now close to 20 years, I can see disease processes that other people, I guess, that don't have the experience I will miss. Now, for me, I can't promise every patient I'm going to catch every scarring hair loss, but I am pretty good at it. And now, if any level of suspicion I have, I send it out to dermatologists before we consider doing a hair transplant on that person. So scarring hair losses, you can Google it. In fact, it's such a passion of mine is that my 4th volume hair transplant book on FUE, which is the only FUE book in the world right now in terms of a major hair transplant book on the subject, all the profits have been donated to the Cicatricial Alopecia Research Foundation, or CARF, to try to figure out how we can eradicate this disease process. I'm not going to go into all the different types of lymphocytic and versus neutrophilic and folliculus decalvans. I can go into hours of discussion of all the classifications of scarring hair losses. That's really for other surgeons and other physicians. If you're very interested intellectually, you can do some research online. I have got actually a lot of information on my website, hairtx.com, as well, for those who are intellectually curious. However, what I'm talking about in this short podcast is how to avoid problems and making sure that the right diagnosis is performed before a surgery. And if you ask yourself, well, how do I know that I'm not having this before I have a hair transplant? Maybe I don't come to see you. Maybe I live in another country or somewhere else. The answer is if the hair loss area that's working starts to look sort of shiny, you don't see the pores anymore, there may be some blood vessels that are there, there may be some itching, redness, something else is going on, that may point to a type of scarring hair loss, but it may not. It could just be psoriasis. It could be anything. And so I don't want to give you too vague a symptom and give you some kind of hypochondriasis about it, but it is important to, if you're having symptoms and things are not right and you don't see me as a hair surgeon, you want to make sure that you truly evaluate the risk of having this disease and have a high level of suspicion if you're having any of those symptoms before undertaking a hair transplant surgery, and maybe speaking with your dermatologist to make sure that having a surgery is safe for you.